Bacteremia is the presence of bacteria in the normally sterile environment of blood, and any amount of bacteria detected in a subject's blood is problematic. Infections are usually divided in two categories: healthcare associated, where an infection develops while receiving care at a hospital, and community associated, where an infection develops outside of a healthcare setting.
Bacteremia causes sepsis, which is the rapid and destructive response of the immune system towards the infection and to the body's own tissues and organs. In the United States each year, 1 million people develop sepsis, with as high as a 30% mortality rate. Quick diagnosis and treatment is essential to increase survival rate, as sepsis can also lead to septic shock, with a mortality rate as high as 80%. Current lab testing to determine the infecting agent requires culturing samples taken from whole blood, which can take time and resources.
To overcome this diagnosis issue, we propose using microfluidics, which deals with the behavior, precise control, and manipulation of fluids at a sub-millimeter or a micrometer scale. Specifically, microfluidic channels allow for controlled diffusion of particles because of laminar flow, which is the parallel flow of fluid streams at low velocities to prevent lateral turbulent mixing. Our microfluidic channel design will be used in conjunction with a laser to diffuse bacteria out of whole blood to be analyzed directly. This separation technique, combined with lab testing, could be used to quickly and accurately identify any bacteria present in the subject's blood.
Here, we present a 3D model of our microfluidic channel. This was designed using COMSOL version 5.0 software. The channel uses two inputs. In the bottom channel, we inject the subject's blood, and in the top channel, we inject a buffer. Our original designs were dimensioned with a channel cross-section of 100 micrometers squared. For the inlet valves, each with an inlet flow of 15 picoliters per minute, and 200 micrometers squared for the diffusion chamber. Our final design increased the dimensions to 10,000 micrometers squared and 20,000 micrometers squared respectively, with a smaller outlet valve for the buffer bacteria solution. After both the fluids have been injected into the channel, at the interface between the fluids, diffusion naturally occurs for any particles present, and net movement will occur from areas of higher concentration to lower concentration. In this case, there will be a net flow of particles out of the blood layer and into the buffer layer.
The laser source, typically in the range of 540 to 550 nanometers, is projected towards the channel favorably to the side of the channel where blood is injected. The laser light creates convective currents that are expected to trap and move particles, and in this way we hope to assist in the diffusion process of bacteria in blood samples.
The output buffer stream will be analyzed for bacterial presence, which should contain a high density of bacteria. Once the bacterial species is known, better antibiotics and treatment can be applied for treating bacteremia and sepsis.
In the future, we hope to develop a prototype that can physically demonstrate the features described here.